Now's the time for stepping out of place.
For more than 145 years, the Dimock Center has provided premium health care and social services to the residents of Boston. First as the New England Hospital for Women and Children, and today as a nationally recognized health center and human services agency. From our historic 9-acre campus in the Boston neighborhood of Roxbury, the Dimock Center offers culturally competent health care, family support programs, and mental health services that many city residents would not otherwise have nearby. The health center alone handles over 46,000 patient visits annually, delivering high-quality adult primary care, pediatric care, women's health care, a teen clinic, dentistry, and eye care, as well as an integrated HIV/AIDS clinic for patients and their families. The Dimock Center's behavioral health programs offer a comprehensive spectrum of support for clients recovering from substance abuse and mental illness. In addition, nearly 400 children visit the Dimock Center campus every day, participating in a range of programs that include Head Start and Early Head Start, preschool, and after-school programs. Our family shelter in the Mary Eliza Mahoney house remains at full capacity, with 26 homeless families relying upon the Dimock Center for shelter, education, and support in their transition to permanent housing. Today, we share with you the journeys of 3 different people who have benefited in many ways from the comprehensive programs at the Dimock Center. In their own words, these are the true face of Dimmock.
Back when my mother was a teenager, 16 years old, she had me. We lived here in Dorchester, and they told her, many people said, you know what, you're not going to amount to anything because you're a teenage mom. And she never believed that. Dimmock Community Health Center, or the Dimock Center now that we know it, they gave her her first internship for college. And what was wonderful about Dimmock, they knew she had a daughter, and I didn't have much childcare, so they allowed her to take me when my childcare failed. So I was 2 years old here, being a big brat while she tried to do her internship, and she was successful. So she loves the Dimock Center for that. I love the Dimock. Unbelievable services located right here in our community, accessible to us. And it's stuff that you would never think about. HIV care, substance abuse care, right all next to your regular health center. So it's so accessible and it's top notch, and you feel like the staff really just loves you and cares about you. It's tough sometimes to find health experts who can speak to all different types of clients and who are comfortable. And we have people and the experts here at Dimmock who really can talk about any subject, and they do it in a way that's compassionate, and you know they care about their clients.
Before coming here, I was involved with different places like the Elizabeth Stone House. I was in a hotel. I've been homeless almost for 3 years. Because of my background of substance abuse, which I also got help here at Dimmock. It was really hard for me to find a stable place for me and my children, so I asked for help. Once I came here, like, everything changed for me because I started doing parenting, substance abuse programs. My whole life changed completely within 6 months. What surprised me was that they had a health center right next door. Because my son was sick, I didn't know what to do. I had to catch like 3 buses to make it to his hospital. And once they told me, you know what, there's a clinic right next door, I was like, wow, this is great. Just to know that my kids had their own beds and how clean it was, I loved it. I've taken advantage of taking the GED. I'm involved with them right now. Because of Dimmock, I see myself as an EMT. Really getting help in school, so I see my children with a big, nice house and happy. I keep on, and I know I'm going to make it.
My mom was a patient here. She had substance abuse problems, and this is one of the centers she came to for her rehab. Well, we were looking for after-school care for our children. They're school age, 13 and 11, and they had a program here. And it's a safe haven for kids. It's a place for them to come and really feel safe to do their homework, to hang out with other students, to meet, not just socialize, but they actually get involved in each other's lives. Centers like Dimmock provide, comfort and care for students as well as the patients that are served here. One of the women who runs the after-school program was telling me about the fatherhood initiatives that they have here. And I went to a fatherhood meeting, and it was just wonderful to see, so many black men of color getting involved in their children's activities. They started with dance, and they had their first recital. I mean, I had tears in my eyes to see the kind of development that they went through, from cheerleading, where they barely move, barely said a word, to where they were actually participating fully and enjoying and interacting with the crowd. That showed so much social growth, that showed so much interpersonal growth as well, that just made you feel proud as a parent. It's actually a gem in the community.
Don't forget I'm